This
is Journal
club. So imagine you have like a video, right? And you wanted to like figure out which part is which. Like let's say even in like a journal club video like this, like how do we know who is who? Like we all look so similar, right? And so like you want to differentiate between us. So that's called segmentation, where you like segment each part of the video. And recently, Facebook, or Meta, better known as Facebook, released their SAM2 model, their segment anything model, the second version of that, which can actually segment videos, which is pretty cool. The first model was able to segment only images, but the biggest feature of SAM2 is being able to segment anything in a video, especially with like prompts, so the user can assign like draw boxes or put like little markers on what they want explicitly to be segmented, or it can automatically segment every part of that image however you want. So
like, for example, if I took a video of my dog running around in the park, I could tell Sam2 or like put the markers on my dog, and it would just automatically track just
the
dog's
dog
movement.
Exactly.
Yeah. So the immediate application I see for this, okay, so like we all have our five senses, right? Okay, and then tell me the five senses.
Sight, hearing, touch, taste, feel.
Okay, and like
Touch and feel.
no, that's not five. Give me the actual five.
Sight, hearing,
Smell,
taste,
touch.
touch.
Okay, so we're humans, and we
Yes.
have
Yes.
those five senses.
Yes.
We are trying to advance AI to a point where it's human-like. But how do we do that? Like, but what senses do computers have? Like, what are we inputting?
We can have any sense you want, but I guess the biggest thing is like computer vision with sight, so
Yeah.
things like convolutional neural networks. And now,
Well, I mean, like so far it's just
Well, it's narrows.
putting in numbers, right?
yeah.
Yeah. So like, how do they actually see the outside world? It just gets like, let's say you take a picture and then it's like 1080 by 1920
Pixels, yeah.
of three matrices with 0 to 255 for red, green, and blue values.
Yeah.
But how does it know, like, it can't know like this group of pixels
Is like a tree, or this group
right,
is,
or this group is like Kevin's earring, for example.
Yeah.
So like recently, like talk a little about like image segmentation first of all.
Usually like it's like features that are extracted from, so like features are extracted from like the model, so you can either predefine like, okay, this is a tree, this is a dog, whatever, and then the model will automatically like use the features that it learns from like how that look or how the pixels are arranged to figure out like, okay, this is a dog, this is a tree, and then apply that to like multiple frames of video.
Okay, yeah. So this is like a pretty recent development. Like we've given computers the ability to see what exactly is in a picture. So now they're able to see what's going on in the video, and maybe we can translate that into real time as well. So now that computers are actually able to see and like differentiate between objects, what applications does that have?
So this is really big in things like, so the biggest two are like security reasons, so like things like security cameras being able to do face recognition, or like things like that, or even things like bomb threats, or like people with like dangerous guns or weapons. But also more importantly in surgical videos, this is really big. So one of my lab's new research interests is surgical robots. And so like being able to segment a surgical video, so you figure out, okay, which one is like the needle, which one's the suction, like the retractors, the actual like body part that you're trying to like examine or perform surgery on. So this is really big for those type of robots, so that it knows, okay, this is that part, and so I'm actually like maneuvering the right part to the right area of the body that I want. And so I've seen this being done on like, in the ophthalmology field, this is really big right now with like, because especially you have surgeries that you need a lot of precision for, because like the body part is just like so small and it's so sensitive to, like you can't really have, you need that precision, right?
Angles and
And so this is it's a field where robots are hugely useful. And so being able to having the robot identify, okay, this is like the retina, these are the different parts of retina, these are like the microvasculature vessels of interest. That is really important, especially when you have like small little like abnormalities. Maybe like one vessel is thicker than another, or just like a slight like clot in one of them. Then you're able to easily identify, okay, that is what I need to focus on. Then I will go and perform surgery on that.
So
Oh, I was gonna ask about that. Has it been able to apply what it learns from one video to another video when it could look similar? Like, for example, if you have a video, her dog's running around a park and it identifies a tree, and then it recognizes something that looks similar in another video. Can it also identify that as a tree? Or do you have to redo it and be like, this is
the model itself is trained on like 50,000 different videos of all sorts of like conditions, right? It's not just medical, it's not just like a dog running around. And that model is also trained on like videos of different orientations, some that are distorted. And what I thought was really cool about this model was its ability to restore videos to like better quality or like fill in missing gaps of videos just based off of what it like knows.
I mean, that's just convention in training these like image and video generation or like segmentation technologies. Basically, you have one picture and maybe you have like 100 pictures in your data set.
Yeah.
I want to expand this data set, but I don't have any more pictures to use. So basically, you can take this image, you can take 20 copies of this and take like for each of these 20 copies, take a little group of pixels out, and basically you've just 20x your training data set.
Yeah, pretty much. But you can also like the model's already trained on these like images or like these videos, but it's also there's been applications of this specifically for medical purposes. So there's something called MedSam2, which is specifically trained in addition to what the videos has already been trained on, especially on like it's been trained on surgical videos, and so that version of it's being used explicitly for surgical purposes, and so it's been trained with like multiple different surgery videos from different body parts to explicitly help like surgeons or like robots.
Yeah.
So I mean,
Oh, I was gonna say, I think that really just ties back to like what Kevin said earlier about how a big reason why we're so focused on AI right now is to get it to the point where it almost has the human capabilities and perceptions that we do. So maybe one day you're in the operating room and instead of having a surgeon doing the work or even a surgeon surgeon team like telling the robot what to do, the surgeon can just sit back and watch the robot do it on its own.
I think the main appeal about that is cost. I mean, when you get getting an open heart operation, there could be like 12 people in there.
Exactly.
You have multiple surgeons that are specialized in different areas of the heart or something similar, and you need a bunch of nurses that are scrubbed in, and you need nurses that are not scrubbed in. You need people reporting on how many, like how much gauze you're using and everything, and so you have to pay for all of that, and operations can be hundreds of thousands of dollars. So by having a robot and you just need like one supervisor, I mean that's
like adding on
crazy.
to that, like,
I mean like
I was gonna say adding on to that, like another application like similar like in relation to like surgical videos is like in my lab we were talking about like a headset, like a VR headset, like some sort of goggles that would actually use the segmentation so the surgeon could see each individual part of like the eye or like whatever other body you want to be able to easily segment it, especially with things like the eye again, which have like a lot of really small blood vessels, to be able to discern differences between each individual one.
Yeah, so like another like further level of aid and like enhancing the precision.
Yeah, so not exactly robots, but like just assisting.
Assistance, yeah.
But like all of this kind of begs the question: at what point are we willing? Like, are you guys willing to trust an AI-assisted surgery right now?
No, I don't think it's anywhere close to being ready, but I'm
it's
sure in
a
the future.
But like, at
possibility
what
in the
point, like,
future.
what kind of developments are needed for you to actually be able to trust it?
High proof of like success rate. I don't know, a lot of regulation in the government, and that like of course opens the discussion for these
ethics and
conversations.
everything.
Obviously being overseen by
About
like an
the
actual
ethics,
surgeon.
right.
Like a lot of people say that like doctors won't necessarily be replaced by robots anytime soon, and I think that's
I also
pretty true.
agree. It's kind of like people were scared of calculators. They're like, people aren't going to do math anymore. Well, now we can do higher level math, so it's kind of, I feel like
The
it's
field will
same
just
thing.
adapt.
Yeah, we'll adapt and we'll be able to do even better things and help more people in deeper levels.
Yeah, some things there are downsides, but there's also really big upsides. So,
Yeah.
I think that's better.
yeah.
And also, if you have like a chronic illness that affects a lot of areas of your
Yeah.
body, I mean, rather than having one person try to track all those changes, I mean, we could identify like, changes anywhere, and the AI could report that and have someone prescribe medication or treatment based on that.
Yeah, and I mean the level of specificity is something that will probably overtake humans in the future. Like it's quite easy for even doctors to say like take a picture of an eye and maybe overlook something that could be significant.
Exactly.
But
Which isn't their fault. It's just
it's just the nature of how things go.
Yeah, I think it's gonna be a great aid, but it's not gonna
It's never
replace.
gonna replace.
Like even now they use robots in surgery, but it's always like a surgeon operating
Yeah.
the robot,
Yeah.
maybe
Right.
like from an external site,
Mm-hmm.
but never.
But the possibilities are endless, guys.
Mhm. There's a lot to be done
Exciting.
with this.
Stay tuned. We'll update.
No.
Let's all signing off. Wait, no, we have to go in order. Like,
What's the order?
Kevin Chen signing off.